In today's video, we're talking about something that has a lot of people nervous, the new Medicare WISeR program. You might have heard the headlines, prior authorizations are coming to original Medicare. It sounds scary, right? But what's really going on might surprise you, and it's actually good news for most of us. So stay with me, because by the end of this video, you'll understand exactly how this program works, why it's being tested, and how it might end up protecting your benefits, not cutting into them. Hi, I'm Matthew Claassen, CEO of Medigap Seminars Insurance Agency. We help people with their Medicare and retirement decisions in 49 states. If you have questions, you can reach us through the Contact Us link below, or of course by calling our office number using the phone number in the upper corner of the video. If you find this information in the video here helpful, please press the like button and subscribe, and leave a comment or a question. Thank you in advance. Not long ago, I posted a video about Medicare's new pilot program called the WISeR model, short for Wasteful and Inappropriate Service Reduction. Since then, a lot has happened, and CMS has released new information that helps clarify exactly what this means for people on original Medicare. So today I want to give you an update and share why I believe this program is a positive step forward for Medicare and for you. So first, let's clear up a common misconception. When people hear the term prior authorization, it often sparks frustrations or fear, usually because of experiences and stories from Medicare Advantage plans. Those plans have a long history of using prior authorizations to limit access to care, delay treatment, and boost profits. So it's natural to worry that original Medicare might start doing the same thing, but that's not what's happening here. The WISeR program is not designed to deny or delay care. It's designed to stop fraud, waste, and abuse. This is about protecting the integrity of Medicare and ensuring that the services paid for with your tax dollars are medically necessary, evidence-based, and beneficial to you. So let me explain how it works. Starting in January of 2026, the new WISeR program will launch in 6 states: Arizona, New Jersey, Ohio, Oklahoma, Texas, and Washington. It will focus only on a limited number of outpatient or ambulatory services that have been shown to be vulnerable to fraud or excessive use. This includes things like certain wound grafts, nerve stimulators, or minor surgical procedures that are sometimes billed when they aren't really needed. Under this model, doctors and suppliers in those states will be asked to submit prior authorization requests for specific services before billing Medicare. But there's an important difference here. CMS is using data and artificial intelligence to identify patterns of potential overuse, not to replace Medicare judgment. Every decision is still reviewed by a human clinician. CMS, Medicare, just confirmed that by 2027, most prior authorizations under the WISeR program are expected to be processed in real time. That means instead of waiting days or weeks for approval, doctors and patients could receive responses almost instantly. And this is one of the biggest technological steps forward that we've actually ever seen in original Medicare. And here's something else that's encouraging. As Medicare develops this technology for original Medicare, it's setting a standard that can be applied to Medicare Advantage plans as well. And that means the same real-time AI tools being tested on the WISeR program could eventually hold Medicare Advantage plans accountable when they use prior authorizations to delay or deny necessary care in real time. Here's why this matters. Studies show that as much as 25% of all U.S. healthcare spending may be wasteful or unnecessary. Medicare estimates that Medicare's share of that fraud and waste is in the billions of dollars. Each year, billions of your taxpayer dollars go towards treatments or equipment that provide little or no benefit. that billions of taxpayer dollars is wasted, much of it due to criminal fraud. The WISeR program is designed to change that by flagging questionable billing patterns before the money goes out the door. This program doesn't change your Medicare benefits. You still have the same coverage and the same access to care and the same right to appeal any decision. The model doesn't target patients. It targets the small number of providers who have been overbilling or abusing the system. WISeR will use artificial intelligence and data analysis to spot questionable prior authorization requests in real time, as well as potentially fraudulent billing. But before you think that AI is going to decide my health care, take a deep breath. Every single recommendation still goes to a human clinician for review. In other words, this program could actually make the system fairer for everyone. It could help ensure that Medicare Advantage plans can no longer hide behind slow or arbitrary prior authorization decisions. As an example, one of my favorite stories, it was told to me by two different insurance companies, is that a foreign organized crime unit set up what looked like a legitimate medical equipment company here in the United States. They then proceeded to bill Medicare for equipment that was never used or sent to the consumer. Their fatal mistake, get this, was when the insurance companies, not Medicare, the insurance companies noticed that the medical equipment was a do-it-yourself in-home catheter. And do-it-yourself in-home catheters just aren't a thing here in the United States. Anyway, that's how they were caught, by the insurance companies, not by Medicare. With the WISeR program, they're more likely to be caught early and by Medicare. It's true that hospitals and doctors have raised some concerns. The American Hospital Association recently submitted comments urging Medicare to make sure the process doesn't create new administrative burdens or delay care. Those are valid concerns, and Medicare has responded by emphasizing that prior authorizations under the WISeR program must be fast, transparent, and clinician reviewed. So this feedback loop is already improving the system even before it begins. The bottom line is this. Original Medicare is using prior authorizations very differently than the insurance companies do. Its purpose isn't to cut back on your care, it's to preserve Medicare's resources for the treatments that truly help people. And if this model works as intended, it could actually improve the quality and sustainability of Medicare for decades to come. It has the potential to correct the weaknesses that we're all very aware of within the Medicare Advantage plan system. So if you're in one of the 6 pilot states and your doctor participates in the WISeR program, don't panic. This is not about limiting your choices. It's about protecting your benefits and keeping the system honest. Now, I'll be watching this closely as it rolls out, and I'll keep you updated on what we learn, results come in, etc. And if you found this information helpful, please press the like button below, leave a comment about how you feel about this new program, and subscribe to my channel so you don't miss future updates. I'm Matthew Claassen with Medigap Seminars Insurance Agency. Thank you for watching.